en la Ciudad de México, en el Palacio Nacional,
Yeah.
y vamos a iniciar la conferencia de prensa diaria sobre la situación
So,
de la pandemia por el nuevo coronavirus 2019, la enfermedad COVID.
all right.
Y hoy tenemos el gusto de
Let's begin with our daily
al
conference.
doctor Jorge Trejo Gómora. El
Today is with
Trejo es el
Dr.
director
Jorge Trejo
del Centro Nacional
Gomora is joining us today.
que esta es la
He is the head of the National Center for Blood Transfusion.
la operación de los bancos
They're in charge of supervising the operation of blood banks and all the different
el abastecimiento
parts involved with blood transfusions.
conocidos como hemoderivados en el país. Y nos va a hablar de un elemento muy
He's going to be talking to us about
uno
two very important points, which is
durante la epidemia de
blood availability of
no habíamos
blood availability in Mexico during the epidemic, because we haven't
Trejo
talked about this, but this is also a part of our strategy, and we've been preparing ourselves on this front since January.
también que es el desarrollo
The second thing he will be talking about
de ciertas
is of public interest,
modalidades de
and
uso de los hemoderivados para
that is
prevención
the current research being done and
tratamiento
the exploration of the possibility of using blood transfusions to treat COVID.
investigación bienvenida.
This undergoing project is in charge, in part, of
Que presentaré yo.
the doctor, and then he will be talking to us about that. So first, I'm gonna be presenting the daily technical report. Then I'll ask Dr. Trejo to share with us what he has prepared, and then we will continue with the question segment.
Tengo entendido, ya les comentar.
Apparently today we're gonna have
Muy bien.
an improved way of organizing the question section.
COVID en el mundo, como ya saben,
Alright, let's begin. This is our daily
entre más
world update.
estas líneas, estas barras,
As you know, the
más casos.
highest these bars appear, the highest the number of cases. These are the dates. They start in January, and the last one is today.
Ven aquí,
And the colors correspond to the world regions,
principales que son
with a special focus on the European region, which is in blue, and the Americas, which is in red, meaning these two zones. And what is represented here is their contribution
número de personas enfermas.
in regard to their burden of disease, which means the number of infected cases,
Las últimas 24 horas
but also more importantly, the people who have been
y como hemos
infected during the past,
Europa
the people who are
su contribución
being actively infected during the past 24 hours.
y en cambio la región de América empieza a subir.
So we can see how the representation of the European region is going slowly decreasing as the Americas representation is slowly increasing.
Vemos algunos elementos
Now this is the national landscape.
que son parte de
We have some important elements to consider when interpreting the advancement of this epidemic. As we've
disminuir
as we've said before, this is not something that can be stopped,
y esto
especially not from
buscando
one day to another, but is something that can be controlled.
que nos
And we can control it through
todas la
safe
modalidad del tiempo.
distance and by staying at home
Como se ve en esta
as much as we can.
representada aquí en colores es
Here we can see the color
personas enfermas
distribution, which is the interval of the number of infected cases that have presented so far in all states in Mexico City. And we have more cases in some and less cases in other. We have
tenemos la mayor carga de enfermedad
the highest burden of disease
101 y 1000
in the
en las siguientes diapositivas.
Mexico Valley area.
Y lo que ven ustedes es cómo el mapa se empieza a pintar de amarillo.
And then you can see how we have
Luego verde,
gone from an originally
amarillo, progresivo.
completely green map. Now we're starting to see some orange patches and darker green patches, and we will continue to see more of these orange patches appearing, and eventually the map will turn reddish. And this is because of the daily developing of the epidemic. So we've been experiencing this gradual process, and it will continue to go in the same pace. We
Una fecha exacta
We don't have a specific date, but we know we will move forward to phase 3. And most probably, during the upcoming 2 weeks, we will be reaching a point in which we have to determine that we have effectively entered phase 3. And this will impact the epidemiological measures that we are implementing. Let's not talk about that now because we will deal with it when the time comes, but I do want everyone to be prepared. Now, what we've said about the way the states appear represented, the whole state is colored, let's say for example with orange, but that doesn't mean that the disease is being manifesting itself homogeneously in the whole state. Even if the whole state is colored with orange, but the highest and all of the cases actually are in the metropolitan city area, are not in the whole state. And we've said that in the state of Jalisco, as well as the state of Sinaloa, as well as any other state, the state governor has the responsibility of the public health measures within their state. They are health authorities within the state, and they have the responsibility that these safe distance and different mitigation measures are being applied, and they get to choose the manner in which they are being applied. Now, we will also talk about the sentinel model that we had been discussing yesterday, and we were saying that we have an estimation number that is different from the confirmed case number, and the estimation factor is 1 to 8. These estimations are done weekly. They are not done daily. They are done weekly using the data we've collected during the week during our analysis methodology, and so far the factor has been 1 to 8. So for each of these confirmed cases, you can multiply that by 8, and then you will have an estimated number of real cases within the country. We also have this number over here, which represents the very, very unfortunate deaths that we are seeing daily. And I want to report that today we've had the very unfortunate death of 2 pregnant women. It's our first 2 cases of pregnant women losing their lives to COVID. One of them died after giving birth. The kid is alright, was stabilized, and I think he will recover, but she passed away, unfortunately. And this is to remind everyone that we've been talking about how pregnant women are at risk, at a higher risk, because they belong to a vulnerable population. And in previous years, we've seen that mother mortality or pregnancy period mortality was severely infected. For example, when we had the influenza epidemic, the influenza pandemic affected greatly the rate of mortality between pregnant women. So we've seen this before. We have to be taking care of our pregnant women, and we have to consider them as very vulnerable populations, so we can extreme precautions. One of these cases had hypertension and morbid obesity, while the other one had also morbid obesity and also diabetes. So she had special kind of diabetes that happens during the pregnancy, but she had diabetes. So made them rest in peace. Very unfortunate news, but we had to present it to you as well. Here we have the incidence rates. The incidence is the number of infected patients taking into consideration the population within each state. And this rate allows us to compare the number of cases, that is obviously a higher number in those cases where the population is higher. But if we divide the number of cases by the number of inhabitants, then we can see how the rates are actually do not vary that much from each other. The orange line is a way of comparing in equal conditions states that have different populations. For example, Mexico City and Quintana Roo, they have very, very different populations. And of course, they have a very visible difference when it comes to the total number of cases. But when we put that in perspective and look at the incidence rate, then the differences are not really big, and so on and so forth. This is the age distribution of these same infected patients. I would like to put an emphasis on two things. First of all, we have received a comment that I highly appreciate from the engineer Duque, and we're gonna adapt this inform based on what he said, because we wanna we've been grouping the together all the statistic for the people that are over 65. But I think we're gonna degroup them and be more specific about them, because otherwise the information is not being presented in a very clear manner, and it can lead to confusion. As we know, from the research we've been able to have access to, after 60 years old, there are important biological and physiological changes every 5 or 10 years in the human body. So it is very important to have more specific, separate groups, and not only one big group of everyone over 65. So we appreciate this comment, and tomorrow the report will look different. This relation, I talked about this yesterday and before that. Originally, we had 20% inpatients, 80% outpatients. That was in the beginning, and for a long time, that was the trend. But ever since we adopted the sanitary mitigation measures, this relation has been changing, and it will continue to change, because the more the people stay at home when they are not at risk and just have a natural recovery, well, the less people are going to be counted in the statistic as outpatients, because they won't reach the clinic. So this relation will show some variation in the future. Here we have the proportion of patients that have been hospitalized, and it's not an updated to now. That this data that we are seeing here is been an average percentage of the different states of patients that have accumulated over the whole length of the pandemic. On this chart, we also received a comment of degrouping, and that's what we'll do, the over 65-year-old age group. We've all noticed, both journalists and technical personnel, that we in Mexico have a higher representation of cases in younger people, and the explanation is that we have an immense burden of diabetes, hypertension, and obesity in our country. This is what I'm talking about. We have the biggest risk factors: hypertension, diabetes, obesity, smoking, kidney failure is the same. Here we have two statistics relating to the fatalities. So first statistic is mortality, This is the amount of people who die because of COVID divided between the amount of people who get infected with COVID. This is the lethality rate. And this is presented per stage. I want to say something that I have said in the past, but it's important. When we have a state with very little population and we have a very, very high lethality rate, the most probable thing is we still need to see more data registered in order to have a more reliable number. Because these states usually, these states with less population usually have very available medical units. There is no saturation of the system, so it's very weird for them to have a lethality rate so high. So it usually has to do with that there's still too few data to have a reliable number. This second statistic is the mortality rate. The previous one was the lethality rate. This one is the mortality rate. And this is the number of fatalities divided by the state's population, disregarding whether they have COVID or not. And it is a different way of measuring it because the mortality rate indicates the importance of COVID as a cause of death in the states within the country and also in the country itself. So we can compare these two numbers and have a more balanced evaluation of the phenomenon of deceased patients in different states in Mexico. This is the technical information we have for today, and now we'll give the floor to Dr. Thank you, Deputy Secretary. Good evening, everyone. Can we show them my presentation? Thank you. For the national blood system, it's very important to have this opportunity precisely to inform and express everything that's happening relating the blood system in our country related to COVID-19. I'm going to be talking about two things. The first thing is the supply strategy for blood during the COVID epidemic. And the other one is a research protocol for the transfusion of blood as a way of treatment of COVID-19. So, previous experiences that we've had with other epidemiological contingencies, with other pandemics, the experience that we are currently living worldwide and in Mexico specifically suggests that there will be a negative impact in the supply of blood. And what is the reason? Well, it's very simple, which is the flux of volunteers who donate blood in public hospitals is decreasing. And this is not a situation that is happening only in this country, it's happening everywhere around the world. And because of reasons that are inherent to COVID-19 and to the epidemic, and other factors that are secondary factors but are related somehow to the epidemic, for example, the possible fear that a potential donor can have of getting out from their houses and going to donate blood. These are all factors that we have to take into account to better evaluate the situation we're currently dealing with. There could be difficulties in the supply of blood and of blood donors within the national blood system. So far, it hasn't happened. We do not have lack of availability, we don't have lack of donors, and we don't have lack of supply. But all the measures that we are going to be implementing are precisely aimed at avoiding this from ever happening. Let's not forget something very important. Blood donation must continue because we have populations of individuals who have some sort of disease or some sort of urgent condition in which blood transfusion is the only method to be able to substitute the blood of these people. And to talk about some groups that apply in this case, there are groups that also require constant supply of blood, a constant process of transfusing them blood. For example, people who have hematological conditions that are impaired in their blood production abilities because of damage that has been received by their spines. So these patients, they have a higher transfusion need than other patients. Also, for example, in those patients who have to receive some sort of chemotherapy, an intensive or invasive treatment, and both children and adults that have to receive these invasive treatments, they will require blood transfusion, and they will require it in a frequent and constant manner. Other conditions require blood transfusions not in a constant and frequent manner, but in an urgent manner. For example, there are children that do not necessarily have a disease, but because they are in an urgent situation, such as an accident, that they require an urgent blood transfusion. In spite of the situation we're dealing with currently regarding the COVID pandemic, these are situations that exist and happen every day in Mexico City. Point number 4. We have also the transfusion of blood components due to mid-short. This is a technical term, but let me explain. There are 3 blood components that we can obtain: red blood cells, plasma, and a third element. The first 2 have a characteristic that means their average life can allow them to be prolonged for a longer period of time. But the third one has a shorter lifespan, because the third one has only 5-day time lapse of being able to survive. And the chemotherapy patients, for example, really need these components, and they need frequent transfusions of this component. And by this component I mean platelets. So as you can see, we have many challenges that we are facing in the national blood system, and they require us to develop a strategy that will help us pull through these challenges and create a reliable blood supply during the duration of this pandemic. The first challenge is the decreasing number of blood donors all over the country. We've registered a decrease of the 60 to 70% in blood donors as compared with information from previous years. Now, so far we have no lack of supply, we only have a decrease in the amount of blood donors. We have the challenge of collecting the blood, but we also have the challenge of allowing the different medical units to use this donated blood in an optimal and efficient way. And a very important part of the national system is the management of human resources that work at blood banks. So, as a consequence of all these different elements that I've been introducing to you, now we can look at this slide that presents the strategy for the safe blood supply during the pandemic of COVID-19. This strategy has been designed at the center and it started being implemented since January the 31st in this country as a consequence of what we were observing in China. So we must be prepared to deal with different scenarios. What is the objective of this strategy? To establish a national plan that will lead to the adoption of measures and decision making that will conduce to guaranteeing blood availability all through the national blood transfusion network. And this for the time and the duration of the COVID-19 pandemic. To reach this objective, we have 4 important points. First, we have to optimize the current stock of blood available. 3, we have to address the question of blood donors. 3, we have to guarantee the safety of human resources at blood banks. And number 4, we have to prevent any of these blood from being infected with COVID-19. So these 4 steps or 4 important elements are implemented through these 10 strategies that are framed right below, and they have been implemented by our teams since late January this year. And precisely to be able to distribute and monitor these strategies and their implementation is that we have created teams as the Transfusional Medicine Committee. Because the Transfusional Medicine Committee is a unit that we have at each hospital and that is in constant communication with us, so we can monitor how the blood transfusion system is working within that hospital. So through these committees in each hospital, we can be aware of the effects of the transfusion, the effects on the donors, and a lot other information that is very important for us. This is a shared strategy because it relies on a communication network, and it was distributed in collaboration with COFEPRIS and with the National Health Council during the month of March. If you read in detail all the different strategies, all of them had been authorized and organized by the Ministry of Health. But I would like to emphasize one in specific. This strategy, what does this strategy mean? That the one that I'm currently showing on this slide. This is the strategy this is a strategy for for sufficient blood supply during the COVID-19 pandemic, and the objective it has is to guarantee blood availability for every patient that needs it. The process of accessing this strategy could be quicker or slower depending on the location of the citizen. But I would like to invite you to write this information down, because we have a phone assistance line that will be with the donor step by step, and we are implementing the safe distance measures in our strategy as well. So as you can see, we have the different phone numbers available, and these are the available numbers for calling the National Blood Transfusion System units, and they are taken by our specially trained personnel that have been trained in terms of both blood donation protocols and also COVID-19 related protocols. So through this strategy, we want to have a constant flux of donors. If you want to donate blood, you call this number and then someone will provide information for you. They can solve your doubts, for example, when it comes to what are the steps for donating blood, what are the conditions to do so, and also they will help you schedule an appointment to donate blood, taking into account safety concerns regarding COVID-19. So through this system, we can be constantly informing the donor and the blood bank personnel, and constantly updating them on the most recent safety measures as well. So I would like to make a call to propagate this information. The de facto need that we have for blood donors at all times in Mexico. It is very important to be aware of to the different needs that will be. We're talking specifically right now of the measurements to guarantee blood supply during COVID-19, but this need of blood donors and blood supply is a permanent need. So please do help spread this information. So as you can see, the national blood system is very important. And in order to emphasize this importance, we have prepared this second section of the presentation. So this is the program. This is the research protocol for utilizing blood transfusion as a means of treating COVID-19. It's a treatment that is currently being researched in Mexico and in other countries. Just to put this into context, and we can make this message better understood by the rest of society, we need to talk about what is plasma. Plasma is the liquid part of blood. There is a liquid part and a solid part. Because blood is a suspension, so it has a liquid part and a solid part. The liquid part is plasma, and this plasma has antibodies, which are proteins that can be useful in the combat of infections. These antibodies are produced by the body as a natural response to an infection. This happens in everyone unless the person has some sort of condition that prevents it from happening. As a consequence of this, let's talk about a topic that is very important right now, which is this specific the convalescent plasma. What is the convalescent plasma? The convalescent plasma is the plasma that is collected from patients that had been dealing with an infection and are now recovering or recovered. What is positive about this plasma is that this convalescent plasma has antibodies on it. So it is a possibility that it can help dealing with an infection in a different patient. The big question is whether this applies to COVID or not. And in order to know the answer to this question, we have to look at other situations around the world. Right? So, why are we doing this research? Why are we researching the effect of convalescent plasma in the treatment of COVID-19? First of all, because so far we don't have an effective treatment against COVID-19, and this is an option that is worth exploring, such as any other. Also, let me be very clear, this convalescent plasma method is not something that just happens to be originating from the COVID-19 epidemic. It's something that has been formulated before. For example, the convalescent plasma has been used in other infection disease outbreaks like SARS-CoV-1, the influenza pandemic of 2009, and also the 2012 Mexico pandemic, and some Ebola epidemics as well. So what happened in these specific situations? Before the convalescent plasma investigations could be successful, a treatment was developed for these diseases, a vaccine came in the market, and then the research didn't continue. However, the convalescent plasma research did continue to some level in some places as a research project, and it led to the creation of some experimental drugs that had been used in countries like China, Italy, Spain, that are currently undergoing clinical trials for the utilization of convalescent plasma in the treatment of several diseases. And also, for example, in the US, it is approved as an experimental drug by the FDA. What I mean to show is this is not something unique to Mexico. It's something that is being researched in different laboratories in other countries in the world. So, let's pose another question that is very important. Is using convalescent plasma in the treatment of COVID-19 safe and effective? Even though it's very promising so far, we haven't seen a full demonstration. It hasn't been proven to be effective so far yet against COVID-19. Also, we haven't established if it could lead to some sort of reaction in the patient. Hence, it is important for us to continue to carry out clinical trials so we can validate this way of treatment as effective and safe. Both, that is, given that is a promising way of therapy that has showed positive effects in other circumstances around the world, it is important to continue to investigate and research. Now, where can we get plasma, convalescent plasma, for clinical trials? Well, in blood banks. In Mexico, all blood banks have the capacity to collect this convalescent plasma through a process called plasmapheresis. So, for example, a patient goes into a donation room, and for this specific kind of collection, instead of being a traditional way of donating blood, the patient goes into a machine, and the machine is called diapheresis, and this machine collects an amount of blood, filters this blood, separates the component that we are interested in, and then it gives the blood back to the individual. That is the way plasmapheresis works. The machine at all times is sealed and in a completely clean and unpolluted environment, and by filtering this blood it can get the elements that it wants. All states all medical institutions in Mexico have machines that allow them to implement the plasmapheresis process. So there are protocols and regulations that control the process of obtaining convalescent plasma for clinical trials, and especially during COVID-19. For example, the centers that are interested in exploring this way of treatment and doing clinical trials, they have to first elaborate a trial essay. Then this essay has to be authorized and registered for the National Commission of Protection Against Sanitary Risks, and then the blood bank or research center needs to notify the Blood Transfusion National Institute that they are soliciting this protocol and that they are abiding by all the regulations in order to be able to carry out these clinical trials. Now, what is the current state regarding this topic in Mexico? The Ministry of Health, through the highly specialized hospital coordinating commission, has created a group of specialists that is in charge of the plasmapheresis protocol. They are currently creating the protocol, and once they are done with the protocol will go in the hands of the commissions that we were just talking about. As you know, because of the influenza pandemic, we already had some advancement when it comes to the start of these trials. There had been some steps that had been already taken by IMSS, so that made our work a little quicker. As you can see, this strategy has some very specific points that are related directly to the pandemic we are currently facing, and these are the two main pieces of information that I wanted to share with you. Thank you. Alright, let's begin with the question section. Yesterday, this number that you gave of estimated cases was it circulated widely during through Mexican media, and I think some people have inferred from this that the government is playing with the numbers. So what could you say about that? And the second question is more a complaint of coming from different workers within the health sector that are complaining that to this day they have not received any equipment and they are working under conditions that are unsafe and insufficient. Some workers at a local clinic did that there was an actual outbreak within the clinic, which contradicts the information that we've been presented so far. Yes, we've been talking about the information, and we've been updating the information related to purchases of equipment and the delivery of protection equipment. For example, the flight that arrived 2 days ago, it had masks, it had gloves, and it was a very large amount of protectional equipment. And this equipment is currently already being distributed, so I think it won't be long for them to have access to this equipment. And talking about the estimation, the number of estimated cases that I presented yesterday, I have nothing to say about it. It's something that I was very clear. It's information that we've had all along, that we have been working with since the beginning, and also this protocol has been worked with for several years now, and it's been currently calibrated. So Yesterday I gave more details, and basically the conclusion um, that we reached yesterday is that this method was implemented when we reached phase 2, and it's a very simple reason. Phase 1 is the introduction state of the virus, and we talked about we had one new cases per day, 0, 1, 0, 2, but all of these cases are related with a specific number of people that the infected person comes in touch with or goes into contact with. So during phase 1, so we were keeping track of the contacted people by these infected cases, maybe 4, maybe 6, in some cases even 60. But as the epidemic developed and we had more and more cases, then this tracking device is less and less useful because it's just not suitable to be tracking every single infected person, because also we would have to do it over a period of 14 days. So as we moved into phase 2, these tracking mechanisms got replaced by the massive mitigation measures that we implemented. Once we reached phase 2, we decided to apply these community mitigation measures, which is the national safe distance journey that will end on April 30th at least, and that will allow us to decrease the transmission rate. The vigilance method that is most appropriate for this extensive phenomena, meaning we have so much cases that is impossible to personally follow each of them. Well, the best method then is the Sentinel method, the Sentinel model, and that's the one I explained yesterday. Thank you. About the 17 soldiers that were infected, we know that they included pilots, intelligentsia, personnel, even generals. So what can you say about that? Also today, Mexico City Governor Claudia Sheinbaum asked for everyone to use face mask. Talking about the military cases, I have no information of that so far, but tomorrow we can talk about it. And regarding the mask thing, yes, the Governor del Mazo of Mexico State and Claudia Sheinbaum, Governor of Mexico City, they did make that recommendation yesterday, and we were working with them and we collaborated with them in order for them to make this recommendation. Why? Because each state of Mexico is different, and the recommendations in each state will differ. Not only there are many factors, but most importantly because, of course, there's a difference in population and mobility. So in the Mexico Valley area, which includes the city and the metropolitan city and the metropolitan area, there is a much higher mobility rate that has in fact been decreasing by 60 to 70%, both public transportation mobility rates and private vehicles mobility rates. But even though we have achieved this decrease, mobility in Mexico Valley area is much higher than in other areas in the country. So we had foreseen that Mexico City was of course going to be, and Mexico Valley area was going to be overrepresented in the burden of disease statistics, and of course would have to apply stricter measures earlier than other states. Regarding specifically the face mask situation, we've said that it is an effective way of preventing contagion when talking about already infected patients that want to prevent spreading the disease around them. Uh, when talking about healthy patients that want to be protected from contracting the disease, unfortunately, that is not. Face masks are not a useful or effective tool because the virus also goes through the eyes, goes through the different parts of the face, and because if you touch your hand with your if you touch your face with your hands and your hands are contaminated with COVID, then you won't be preventing the virus from entering your body. So I want to be very clear to when talking about this because washing your hands regularly and keeping safe distance are more effective methods. But of course, everyone is looking all sorts of ways of being safer. Um, even when talking about the face mask, the World Health Organization first emphasized that it was a very effective way, but then some days later they qualified their statements and they said, well, there is no evidence of face masks being that important. Talking about protocols that were presented this week, I wanna talk about the one that has to do with prisons. Are you considering temporary releasing or early releases of some inmates? Because I think there is a recommendation in this regard by the United Nations. So I want to know if the Mexican government is considering this at all or it has been discarded. Also, I would like to know how do you determine the discharge of a patient from the hospital. I ask this because in the private sector we've heard about protocols such as testing the patients 3 times in order to discharge them. In other countries, we've seen cases of them applying the test twice before they can discharge them. But some other places argue that it is enough to have a 14-day isolation period and then they can be discharged. Discharged. Yes, very important question. Thank you. And some people have been expressing this concern. For example, people who have been infected and had been provided treatment by a hospital, by a public hospital, and sometimes they've said, well, it's because the public hospital doesn't have enough money to apply the test that is incorrect, that is false. We have money and we have enough money to buy all the tests that are necessary, and if we need tests, we will buy them. So that is not a problem. It's not a general answer that I will give to you. Some patients have a very high burden of disease. We call in not of a burden of virus. The burden of virus is the concentration of the virus components in the sample that we analyze. These tests that are PCR in real-time tests, the amount or the concentration of the virus is measured by the number of cycles present in the process of amplification of the generic material that is needed for the signal to be detected. The more cycles, the less burden of virus. The less cycles, the more burden of virus or presence of virus. So the duration of the viral burden is, or the duration of the infection is longer, the highest the viral burden is. So sometimes in patients with really high viral burdens, they have to be tested twice or thrice. But in other occasions, in other situations, we have identified that the active disease period ends on day 12 or 13 or 11 or 12, and we extend that to day 14, and that is a good enough measure to discharge the patient. Regarding your question about prisons, we have shared some protocols here and in other instances about the treatment of these inmates. I have 2 questions. First one is relating to the pregnant women. Today we were publishing some information regarding pregnant women being afraid of even going to the hospital. So I want to know what are the special cares that we can have when dealing with pregnant women that are late into their pregnancy and that have conditions such as hypertension or diabetes. What are some special precautions that can be adopted by them? And then also talking about the blood transfusion mechanisms, is there any type of blood that is in more demand by the system, um, or less, or is will there be any elements that are more needed than others? Well, what kind of blood is most required? Blood. Just blood in general. There are systems of blood that are known to you, for example, AB0 or ABO, but we need donation, period. The most frequent kind is O positive, as is popularly known. But there is also need of transfusion of red blood cell, platelets, or plasma. So different kinds of plasma can be useful for different things. So I won't go into specifics, but what I want to emphasize is we require blood donors in general. Period. We require blood donors. Thank you. Please do spread this message. All those people who are in conditions of donating blood, please do donate blood. We will put the link and we to this information system, and we will place the phone numbers on our official websites as well. Uh, and we've been implementing these protocols for the blood donors to be able to donate under safe conditions. We've said right now there is no lack of supply, but if you stop donating blood, then we will have lack of supply. So it is very important for you to go donate blood. And talking about the pregnant women, the prevention measures are the same. It is very important to stay at home, to keep your safe distance, especially for pregnant women and women with chronic diseases. It's very important for them to stay at home. If someone in your job, in your workplace, is not allowing you to, or if you're looking for a job and they don't give you pregnancy disability, you should denounce them, and you should not accept that because that is illegal. You shouldn't be afraid of being fired because of not going to work if you're pregnant, because that's illegal, and we will see that those companies are punished. So you should denounce it and stay at home. And if a pregnant woman is infected with COVID, disregarding whether they get tested or not, they must seek medical treatment. If a pregnant woman has fever, for example, it's not that they have to go to the emergency room at that very moment, but next day when they get up, call your doctor and go to seek medical consultation. What are you offering for potential donors to guarantee their safety when going to donate blood? The first incentive that incentive that should be present for all of us is that all of us could need blood transfusion at some point in our lives, and the best donation is that is voluntary and solidary. So If you call the phone lines and ask for assistance, we will direct you to the closest donation point so you don't have to travel a very long distance, and we will help you make an appointment. Of course, we are looking for the blood of healthy people, right? But the first incentive for any of us to donate blood is the thought that we all need blood. We can all need blood at some point in our life, and it depends on our solidarity and or on our willingness to donate. Thank you. It's 8 right now, so yeah. The relevant information for donating blood are very clear, and they will be published on the official website. Thank you.